So we are going to discuss about zirconia as a restorative material, and this is the second part of a ceramic series. Zirconia has increasingly become the ceramic material of choice because it satisfies desired criteria of both optical and physical properties. It is classified as a polycrystalline ceramics without any glassy particles. It is a polymorphic material. Polymorphic material means it material that exists in different forms. So this zirconia exists in three temperature dependent phases, and each phase have a same chemical composition but different atomic arrangement at different temperatures. Now three phases of zirconia includes monoclinic form, tetragonal, and cubic. Now, first point is that first we discuss monoclinical phase. Monoclinical phase, it is this phase is stable at a temperature of 1170 degrees Celsius. Property of this phase. This phase is characterized by high fracture toughness and resistance to crack propagation. Second phase is tetragonal phase. Again, this phase is stable between 1170 degrees Celsius and 2370 degrees Celsius. It offers high mechanical strength and is toughened through transformation toughening. Cubic phase is classified as the weakest phase of zirconia, and this phase remains stable above 2370 degrees Celsius. Compared to monoclinic and tetragonal phase, it is the least tough. Now, the significance of these three phases of zirconia uh, will be discussed later on. Now move towards the properties, basic properties of zirconia. Let's discuss about the physical properties. Physically, they are much more tougher and stronger than conventional glass ceramics. And due to their high strength, they are used as a in posterior areas for fixed dental prosthesis. Flexural strength of zirconia is twice that of aluminum oxide. But there is a one drawback associated with hardness of zirconia, and that drawback is known as it causes wear of opposing teeth. Opposing enamel is 10 times less likely to be worn by polished zirconia than veneering porcelain. Now, in our routine practice, there also exists a polished zirconia, glazed zirconia. If we compare polish and glazed zirconia, then polished zirconia are more friendly. They less likely to cause wear of opposing dentition in comparison to glazed zirconia. Here are the key strategies to minimize wear. Very first, you must ensure anterior guidance because anterior guidance will leads to the separation of posteriority that minimize the chances of wear. And before moving towards definitive phase, you will eliminate occlusal interferences. And in case of functional bruxism, high occlusal forces use gold alloys rather than moving towards zirconia. And if occluding surface are in contact with zirconia, then you will use small particle veneering porcelain on the occluding surface. Polish ceramic surfaces periodically, adjust occlusion periodically if needed. Now, second properties, optical properties. Optically, zirconia has been regarded as the opaque restorative material with optical and aesthetic properties less attractive than glassy ceramics. Means if we compare zirconia uh, with other type of ceramics, they are classified as opaque. They are less translucent because they have an increased crystalline content. So if patient wants aesthetic in high aesthetic areas, we veneer the zirconia restoration means uh, veneered zirconia means if we cover the surface of zirconia with flash phatic porcelain for aesthetic reason, then it will be known as a veneered zirconia. But there are limitations of such a step. That limitation include it leads to the chipping and fracture of porcelain due to mismatch of coefficient of thermal expansion. Second, surface grinding. Third one is inadequate core design. Fourth one is overloading. And fifth one is difference in fracture toughness and modulus of elasticity of two materials. How to overcome such limitations? So during baking stage, you will follow slow cooling protocol. What will it do? It dissipate the heat. Second, use of monolithic zirconia. So through such strategies, we can overcome the chipping and fracture of porcelain. So another mechanical property we are going to discuss, that is known as transformation toughening. So transformation toughening is the mechanical property of zirconia. What is the significance of this property? It leads to the arrest of crack propagation. How it arrests uh, propagation of crack? Let's discuss this property through this picture. As I have discussed already, three different phases of the zirconia, that is monoclinic, tetragonal, and cubic. Among these phases, the weakest phase is known as cubic phase. Now, suppose there is a property that, for example, now this red arrow shows tensile stresses. These stresses will cause the crack to propagate. So, when a crack develops on the surface of zirconia, what will happen? It induces the metastable. These are known as tetragonal crystals with orange color. Orange hexagons, they are classified as a metastable tetragonal crystals. And when uh, tensile stresses causes the crack to propagate, then these metastable crystals, tetragonal crystal, they transfer into monoclinic form. These orange hexagon with a green cover, they are classified as a monoclinical crystals. Now, what are the significance of this transformation? When tetragonal crystals are transferred into monoclinical crystals, so due to large size, they are larger in size, monoclinical crystals. They are larger in size and volume. So these crystals, what will it do? They will create a compression, generate compressive stress. Now these black arrows are known as the compressive stress on the crack. So this stress prevents this compressive stress. What will it do? It balances tensile stresses and prevents crack propagation. So this whole phenomena is known as transformation toughening. Again, what do you mean by transformation toughening? Zirconia is characterized by a mechanical property known as transformation toughening, which is related to the presence and percentage of yttrium oxide it contains. Again, the role of yttrium oxide will be discussed later on. So, what will happen when zirconia transfers from its tetragonal to monoclinical phase on cooling? Shear strain occurs with increase of 4 with the volume increase of 4%. Means when during cooling due to stresses, zirconia transfers from tetragonal to monoclinical phase, then it also accompanied with increase in volume of up to 4%, and this increase in volume will create a compression stress at the crack tip, thereby increase fracture toughness as well as dispersing the energy results in arrest of crack propagation. This was whole discuss role of oxides. Now moving towards the role of yttrium oxide. Basically, zirconia is naturally unstable at room temperature, and to stabilize something we have to add oxides, which are known as stabilizing oxides. Zirconia is naturally unstable at room temperature. However, when a stabilizing oxide such as yttrium oxide is added, it stabilizes zirconia in its tetragonal or cubic phases at room temperature, making it suitable for dental applications. Now, yttrium amount of yttrium can be added in 3%, 5%. If we are adding yttrium oxide in 3%, then a lower yttrium content enhances strength and toughness. And if we are adding yttrium oxide in 4% or 5%, then it improves translucency, means 3% yttrium oxide are suitable for use in posterior areas, and 4% or 5% yttrium dioxide are suitable for use as for aesthetic purpose to improve translucency. Now, on the basis of oxides, zirconia can be classified into fully stabilized zirconia and partially stabilized zirconia. Now, what do you mean by fully stabilized zirconia? So, fully stabilized zirconia, basically they are referred to the cubic stabilized zirconia, primarily consist of cubic crystals at room temperature with a concentration of yttrium oxide greater than 8 molecular percent. The presence of cubic phase enhances zirconia translucency but may compromise its mechanical properties. And partially stabilized zirconia, they contain a metastable tetragonal and cubic phase mixture when the amount of yttrium oxide is 3 to 8 molecular percent. They are also known as tetragonal zirconia polycrystals. Now, what are the generations of zirconia? Zirconia has undergone various modifications to enhance its clinical use as a restorative materials. There are four generations of zirconia have been reported in the literature. Very first generation is known as conventional zirconia. Now, the properties of these conventional zirconia include they contain 3 molecular percent yttria, and they are strong monochromatic, white and opaque in nature. They are mainly used as a coping or frameworks veneered with more aesthetic ceramics. Second generation contain 3 molecular percentage yttria, and the amount of aluminum is reduced in comparison to f- uh, conventional zirconia. Amount of aluminum in second generation was reduced, so they have improved translucency when compared with first generation zirconia. They are more translucent. They can be used as monolithic restorations. They are referred to as second generation is referred to as translucent zirconia. Now, third generation, they contain 5 molecular percent yttria. They are characterized by improvement in their translucency owing to the increased amount of yttrium oxide. They have decreased mechanical properties due to cubic structures, and cubic phase lacks transformation toughness. 4%, fourth generation, they contain 4 molecular percentage yttria, and they have a improve flexural strength and fracture toughness but decreased translucency. They consist of approximately 60 to 75% tetragonal and or 25 to 40% cubic content. They are favored for chair side milling. Now again this term we will discuss in third part of the zirconia. Sinetering, milling, these are the manufacturing steps in the fabrication of zirconia. Another important properties we are going to discuss, that is known as low temperature aging degradation late, or it is also known as stress corrosion phenomena. Now, low temperature aging degradation. What happens in this phenomena? Usually, this type of process occurs in wet conditions at low temperature. When there is a temperature without any external stimuli, without any mechanical stress in the form of occlusal, without any occlusal forces, in low temperature or in wet condition, this phenomena occurs. Low temperature aging degradation is another phenomena that occurs in zirconia in wet atmosphere at low temperature. In this phenomena, there is a spontaneous transformation of metastable tetragonal uh, to monoclinical phase. Like in monoclinical phase, despite the lack of any mechanical stress. The transformation of monoclinic to metastable tetragonal occurs during tensile stresses, as we have already discussed in transformation toughening. So, but in comparison to transformation toughening, low temperature aging degradation occurs in wet condition without any tensile stresses. So during wet atmosphere at low temperature, there is a spontaneous transformation of metastable tetragonal to monoclinical phase. Now, this phase transformation is isolated to suspectable surfaces of the material. It also this phenomena also accompanied with volume expansion, but the increase in volume in this phenomena leads to the formation of macro cracks, micro cracks, surface roughening due to the penetration of water that leads to the fracture of the restorations. So transformation toughening leads was associated with arrest of crack propagation, but low temperature aging degradation, it is one of the failure of the restoration that leads to water penetration and conversion of macro cracks from micro cracks, leading to the failure of the restorations. But this is affected by this phenomena is influenced by certain factors: grain size, grain distribution, stabilizer concentrations, environmental factors, and presence of residual stress. So we have to overcome this phenomena by surface glazing and porcelain veneering. They helps to reduce low temperature degradation as zirconia is not exposed directly to wet environment. Now the most important aspect of the zirconia, that is the APC zirconia bounding technique. How will you bound zirconia? Very first, zirconia you cannot age zirconia. Zirconia cannot be aged by hydrofluoric acid or phosphoric acid. As we have already discussed the bonding protocol of the lithium disilicate in which we were using hydrofluoric acid of different concentration for a different duration. But zircon you cannot age, you cannot use hydrofluoric acid for the bonding purpose of zirconia because zirconia is inert, non-polar due to the absence of silica. So in order to achieve cementation of zirconia, you have to follow a certain protocol, and that protocol in literature is known as APC. A stand for air particle abrasion, means you have to treat the untreated fit surface of restoration with aluminum oxide particle at low temperature, and the size of particles to be used for this purpose is 50 to 60 micrometer. What will it do? It will roughen the internal surface of restoration, it will improve resin cement flow, and it will increase micromechanical retention. This is the first step. Second step, you have to apply primer, and for bonding of purpose we use specific ceramic primer that contains 10 mdp. It is a special primer, universal adhesive. It is bifunctional. It have two functional groups. One is known as phosphate based and second one is known as methacrylate based. Through phosphate based functional group, it forms bond with zirconia, and through methacrylate based functional group, it forms bond with dual cure or self cure resin cements. These two steps, air particle abrasion and application of primer, they are the part of tribochemical effect which allows zirconia to be cemented with resin cement. C stand for cement. And we use dual care or self cure composite resin to ensure adequate polymerization. Why we use dual cure? Dual cure can be activated both light and self cure. They have a controlled working time, short setting time, and in deeper preparation, chemical initiator will interact to achieve polymerization. So, what are the problems usually encountered when bounding zirconia ground? Zirconia cores cannot be effectively aged with any non-acid because they are uh, non-polar. They are inert in nature due to the absence of silica. Zirconia has a strong affinity for proteins found in saliva and blood. When you are going for trying of zirconia, then it leads to the attachment of proteins that form that weakens the cementation. So after trying and before cementation, you have to clean the internal surface of zirconia through sodium hydroxide. And third problem, we use of air particle aberration. This point is I have already discussed. So here is a diagrammatic representation of how to bond zirconia. The APC concept. Very first, you have to clean ultrasonic alcohol bath or sodium hydroxide. Then you have to, after trial, try and clean the restoration ultrasonic alcohol bath for 5 minutes or use a special zirconia or ceramic cleaner. Second step, air abrade. You use aluminum particles 30 to 60 micro to roughen the internal surface. Third, apply the primer, special zirconia primer. Apply a layer of special zirconia primer to the bounding surface. And then fourth, you will apply dual cure or self cure composite resin cement to complete the bounding process. So this was the second part of zirconia.